Welcome to Nutritional Medicines by Lab Analysis. My name is Dr. Cyrus Thomas, and I am going to explain some things that we've explained before in other shows with you, but it's sort of the basis of the work that I do, so it's important that we know the material. What we're doing essentially is we're using medical analysis by doing blood, hair, and urine studies, and we are treating with nutritional treatment because there are no side effects when you do not use pharmaceuticals. A wonderful thing. We're also doing hair analysis, and the reason why hair is indicative of the condition of the blood and the cells of the body is because as the hair follicle is being made in the scalp, a vein and an artery are involved in the creation of that shaft of hair. And so the ratio of different substances in the blood is reflected in the hair. A hair analysis gives us, the first half are all heavy metals. And these heavy metals are, for example, arsenic, barium, cadmium, lead, mercury. We don't want any of them to be in the blood. As they begin to move through the green to the yellow and the pink, we're getting sicker and sicker because these heavy metals get in the way of chemical reactions. We don't need that. The other half of the hair analysis is what are called essential elements, and they include mostly what we call minerals. We want those to be in a balanced state, not to be too little or too much. So we get a lot of information from that. In a blood test, we're doing 52 different substances. In this case, this column represents the results on the first blood test under the prior column. As the patient went along, a number of months later, they retested, and you can see where yellow is a warning sign, red is a risk, and blue is dangerous. We see that the blues have disappeared. We see that most of the reds have either turned into yellow or disappeared, and there still remains a red and several yellows to deal with here. So as we go through time, we actually see the progress being made as we put the lab results in parallel. We're also using a more narrow range for what we're calling normal. We're using a more stringent range, functional lab range versus this is the functional low value, the functional high value. We're essentially bringing it in from here to here, and we're saying you need to be here. Reason being is a lot of people will go to their physicians, they'll say, you're saying that my blood tests are fine, there's nothing wrong with me, but I feel really lousy. So it's because oftentimes their values are in the light green and not in the dark green. Nutritional remedies are superior medicines, much more superior to using pharmaceuticals. Pharmaceuticals will, not only is there 3 to 4 pages of side effects on each one of them in the PDR, but they're so specific that, in what we want them to do, we ignore the other 30 things that they are doing, which are things we do not want them to do. Tonight we're talking about the thyroid, and the thyroid is one of the largest endocrine glands. It controls how rapidly the cells make energy. They do other things as well. The endocrine glands are all over the body. We have ovaries. In the male, they are the testicles. In the female, and in both sexes, we have the pancreas. We have adrenal glands that sit on top of the kidneys. We have the thyroid gland in the front of the neck, which also has the parathyroid glands attached to it. And then up in the head, in this section here, we have the pituitary gland. Now, these all create hormones, and hormones are molecules that flow in the blood, and they're essentially messengers. They'll go into the blood here from the pituitary, and they'll go all over the body, and other parts of the body will recognize that chemical that's in the blood, that hormone, and say, okay, we're supposed to do something. Now that's a slow way to get a message from here to here, but in a faster way is to use the nervous system through the brain, the spinal cord, and the nerves. But we can use hormones, and it keeps a good steady state balance to the chemistry of our bodies. What does a thyroid do? It controls how quickly the body uses energy, and how fast it makes proteins. It controls how sensitive the body is to other hormones. It participates in these processes by producing thyroid hormone, the principal ones being triiodothyronine, T3, and thyroxine, T4. There is hyper and hypothyroid conditions. The most common problems of the thyroid gland consist of an overactive thyroid gland referred to as hyperthyroidism, and an underactive thyroid gland referred to as hypothyroidism. You can see that the thyroid exists in the front of the neck. It's in front of the trachea, which is essentially our breathing tube, and it's underneath the larynx, which is where our voice box is. It's a small gland, and it looks larger here in this picture, but it's really quite small. In hyperthyroidism, you can get a number of symptoms. One of them is exophthalmos, where the eyes tend to look like they're bulging because the muscles of the eye actually swell. Hyperthyroidism, or overactive thyroid, is the overproduction of the thyroid hormones T3 and T4, and is most commonly caused by the development of Graves' disease. It is an autoimmune disease in which antibodies are produced which stimulate the thyroid to secrete excessive quantities of thyroid hormones. The disease can result in the formation of a toxic goiter, and that's when you see a person with that swelling on their neck. A thyroid goiter, these are symptoms of hyperthyroidism. A thyroid goiter, protruding eyes, the exophthalmos, palpitations, which is irregular beatings of the heart, excess sweating, diarrhea, weight loss, muscle weakness, and unusual sensitivity to heat. The appetite is often increased. This unusual sensitivity to heat, I once had a patient who wanted her home at 87 degrees. After treatment, she was able to put it down to about 78. That made her husband rather happy. In hypothyroidism, it is the underproduction of the thyroid hormones T3 and T4. Hypothyroid disorders may occur as a result of congenital, that means from birth, thyroid abnormalities, and autoimmune disorders such as Hashimoto's thyroiditis, iodine deficiency, more likely in poorer countries, or the removal of the thyroid following surgery to treat severe hyperthyroidism or thyroid cancer. Sometimes we have one turning into the other. Some of the symptoms of hypothyroidism, again, are abnormal weight gain, tiredness, baldness, cold intolerance, bradycardia. Hypothyroidism is treated with hormone replacement therapy such as levothyroxine, which is typically required for the rest of the patient's life. This is what the medical journals will tell you. We're going to tell you something different today. Initial hyperthyroidism followed by hypothyroidism. Essentially, you're so hyper that you burn out the thyroid gland and it becomes hypofunctional. This is the overproduction of T3 and T4 followed by the underproduction of T3 and T4. There are two types, Hashimoto's thyroiditis and postpartum thyroiditis. Of course, the itis at the end of thyroid means that there's some inflammation of the gland. Also, T3 and T4 are two interesting thyroid hormones. Most of the production, one turns into the other, and the difference between the 3 and the 4 is really an iodine molecule for the most part. How do these hormones work? What is metabolism? What does that word mean? And increasing metabolism and controlling metabolism. These are the functions of the thyroid. It just controls how fast our body is working or how slow. T3 and T4. The primary function of thyroid is the production of the hormones triiodothyronine, T3, and thyroxine, T4. And the thyroid also makes calcitonin, which is involved in bone, creating bone. It also has on the thyroid gland two parathyroid glands, which make another hormone, parathormone, which works the opposite of calcitonin. Up to 80% of T4 is converted to T3 by the peripheral organs. That means the organs away from the thyroid, such as the liver, the kidney, and the spleen. T3 is several times more powerful than T4, which is largely a prohormone. So T4 is a prohormone. It's before a hormone. It turns into T3 and it becomes a full hormone and can be up to 10 times more powerful than it was previously. Perhaps 4 to even 10 times more active. Triiodothyronine, also known as T3, is a thyroid hormone. It affects almost every physiological process in the body, including growth and development, metabolism, body temperature, and heart rate. These hormones speed up everything. Basic metabolic rate. T3 increases the basal metabolic rate and thus increases the body's oxygen and energy consumption. The basal metabolic rate is the minimal caloric requirement needed to sustain life in a resting individual. T3 acts on the majority of tissues within the body with a few exceptions. So it's the speeder upper and the slower downer. Glandulars are products, this one's made by Allergy Research, using a similar tissue to treat a problem, taking thyroid in desiccated form, which means in its dried form. You actually take thyroid tissue. Synthroid is what most people get. Must you take it? People are told they have to take it for life. Fallacy. Perhaps one of the most common fallacies doctors regularly repeat is that Synthroid is the only treatment for hypothyroidism. Actually, Synthroid is a brand name for the drug levothyroxine, a synthetic form of the thyroid hormone thyroxine, also known as T4. Giving the thyroid what it needs. Finally, there is a category known as natural thyroid. Armor thyroid, but also available are biotech and nature thyroid. They're made from dried thyroid gland of pigs. It includes natural T4 and T3, plus other less understood thyroid hormones, including T2 and T1. Some practitioners, and in particular holistic practitioners, integrative and natural health experts, find that natural thyroid is optimal for some patients. A case history. There are so many thousands of case histories of people who have been able to get off thyroid hormone, it almost seems ridiculous to talk about it. Mary R. was told by her doctor that she'd probably need to take thyroid hormone for the rest of her life. She went to a doctor who used nutrition instead, who within weeks was able to get her thyroid levels back to normal. What if she had taken the hormone her whole life? Well, not only is it a complete waste of money, but you're taking a synthetic hormone which encourages the thyroid gland not to make its own hormone. And that's the problem with replacement therapies. Same thing with hormone replacement therapy. You encourage these glands not to make their own hormones. Of course, taking thyroxine is a hormone replacement therapy. In this case, just like taking sex hormones would be hormone replacement therapy. There are vitamins and minerals for the thyroid. Quercetin is one, vitamin D, iron, and zinc. Quercetin is a flavonoid, and you've all heard of bioflavonoids. They talk about the rind and the coverings of fruit. Foods rich in quercetin are black and green tea, capers, lavage, apples, and onions. This is a complicated chart. I'm going to take a little bit of time and explain it to you because I'd like you to take a complicated medical chart and get you to feel comfortable knowing that you can interpret this as well as anybody. So here we're looking at a thyroid follicle, and it has all of these individual cells in green and orange around the very edge of it, okay? And we're just going to look at this little section right here in this rectangle. It has a little bit outside the follicle. It has a couple of cells on the lining, and then the red part is the inside of the follicle. So here essentially is the blood vessel on the right side. The blood's going by. Things can enter into this cell. This is the cell here, this with the blue background. And then things can exit and enter from this reddish area here into the cell. So there's a nucleus, and out of the cell that's inside this big one, from the nucleus, the endoplasmic reticulum is excreted a thyroglobulin grouping of molecules. It gets near the edge of the cell, and it's able to actually break the wall and exit through what's called exocytosis. This thyroglobulin gets changed. It goes through iodination and conjugation. There's oxidation taking place, and it re-enters into this cell called endocytosis, and then it goes through a breakdown of proteins, proteolysis, and you end up with a container that has thyroxine and triiodothyronine, T3 and T4. And then they can exit into the bloodstream, these blue arrows, and go to all parts of the body and become part of this systemic circulation. So that's how it's done. That's actually how it's done by the thyroid gland. It's kind of cool, isn't it? A code of honor by Van Merkel, a famous chiropractor in Dayton, Ohio. He said it's an awesome responsibility, humbling when a patient comes to him, because this patient entrusts their most valuable possession to him, their health. He says, I will not and I must not be distracted in my consultation reports or duty to them. I will not order one test or recommend one vitamin more than is necessary, but neither shall I shirk from my duty to tell the truth and recommend what I know to the best of my ability to promote health. And that means, of course, that he's not going to recommend any, he's not going to keep from recommending things that he really thinks you should do. And I'm adopting that same principle. For without health, how can one fulfill their optimum potential, which is to have a purpose in life? This is my office and my website, integrativealternativemedicines.info. And on this website, you can find many things. There's going to be many DVDs, several of these shows that I've done here archived on there. There's also a blog and a newsletter. And there's quite a few case histories. And sometimes you can find your own problem there, find out what a person went through to get well through blood, hair, urine analysis, and then to go through the program where you receive nutrients to correct those values. You go on 2 months, if it's a severe condition, maybe 4 later, and you retest, and then you look and see what's happened to those blood values. And also looking at the heavy metals that show up on the hair analysis, see if they've reduced. We use oral chelation methods to actually take the heavy metals that are in the blood and chelate them. To chelate them means you join them through chelation, through joining, and then you can urinate those heavy metals out of the body. They get in the way. Also, you've heard of free radicals. Free radicals are molecules that their electron balance is off, and they interfere with the turning of one molecule into another, which has to take place literally hundreds and hundreds of times. I'm going to cut this show a little short tonight. My voice is going. It's called Preacher's Voice, and it got me tonight. Thank you for watching the program, and may you be in good health.